How to Keep Your Penis in Shape by Dr. Judson Brandeis, Board Certified Urologist. I am Chief Medical Officer of AFFIRM Science and Director of Clinical Excellence for GAINSWave. As we age, health and physical performance deteriorate. On the left side of the slide, you can see the world marathon records for men and women starting at the age of 30. As runners get older, the marathon age group records get slower. On the right is the age group record for the men's 100-meter swim. As you can see from the graph, as age increases from 20 years old, every decade the time across the pool gets slower and slower. And if you look at the general population, the VO2 max, or the measure of the maximum rate of oxygen consumption, tends to decline by about 10% per decade after the age of 30. The athletes who continue to train and compete can reduce the drop from 10% to 5% per decade. Erectile dysfunction shows a similar trend. On the graph, you can see the probability of erectile dysfunction in healthy men increases every decade. For those patients with cardiovascular disease or diabetes, the rates are higher. From the previous slide, we know that if we make an effort to keep our heart and muscles in shape, instead of a 10% decline per decade, we can expect a 5%. Erectile function is an important part of quality of life, and most men would like to maintain that aspect of their quality of life. So the question is, what can you do to support your ability to keep your erections in shape and enjoy continued physical intimacy as you age? Increasing the blood flow to the corpora cavernosa of the penis creates an erection. The heart pumps blood into the aorta, which leads to the common iliac and then the internal iliac arteries. The blood finally finds its way into the internal pudendal and then penile arteries. When the penile arteries fill the corpora cavernosa with blood, the penile veins are compressed, which reduces venous return and creates a rigid erection. So how can we ensure that this process remains healthy for us for as many years as possible? An essential factor is replacing the critical signaling molecule, nitric oxide, which declines with age. Nitric oxide repairs damage to the lining of arteries, which maintain the elasticity of blood vessels and prevent blood clots. When a man is in his 50s, his nitric oxide levels are only 50%, and by the time a man is 70, his nitric oxide levels can be less than 20%. Nitric oxide is critical to an erection. It's released by the cavernous nerve and the endothelial cells, and it initiates a cycle that results in smooth muscle relaxation, causing increased blood flow into the penis. Now there are two main options to dilate arteries and fill the penis with blood. One is to increase the amount of nitric oxide produced in the arteries. A nitric oxide booster like AFFIRM works this way. The other is to block the enzyme that converts cyclic GMP back to GTP with a PDE5 inhibitor like Viagra or Cialis. These medications will also help keep the penis in shape. AFFIRM is a nutritional supplement which is packed with natural nitric oxide boosting ingredients, including L-citrulline from watermelon, red beet extract, Asian ginseng, and Mura puama extract. Now another way to take your penis to the gym and restore essential blood flow is GAINSWave therapy, which is a non-invasive treatment that semi-permanently improves penile blood flow. 75% of men with mild to moderate ED respond to this innovative therapy that has no significant side effects and minimal discomfort. GAINSWave is ideal for treating mild to moderate ED and also preventing the development of erectile dysfunction. GAINSWave works by producing a strong pulse of energy which creates cavitation bubbles which expand and then collapse, stimulating the activation of stem cells, production of vascular endothelial growth factor, release of nitric oxide, and growth of Schwann nerve cells. At the cellular level, the shockwaves produce microtrauma, which leads to the release of vascular endothelial growth factor, an increase in nitric oxide synthesis, and the growth of new blood vessels as demonstrated on the right panel. The image on the left shows evidence of stimulation of stem cell expansion. Vacuum erection devices are often overlooked but can also improve penile health. This is a safe, easy, and painless procedure. A man places the cylinder over his penis and activates it to create a seal. Arterial blood is pulled from the pelvis into the penis, which then creates length, girth, and lift. Vacuum devices are effective because the arterial inflow increases oxygen levels, which reduce tissue hypoxia. By stretching the penis, the vacuum device inhibits abnormal collagen or scar formation and prevents cavernosal tissue fibrosis. The benefits of healthy men using a vacuum erection device are better oxygenation of the penis, which can delay and possibly reverse the destructive processes of aging on the penis. A middle-aged man using a vacuum device once a day will help prevent fibrosis and poor circulation. We generally recommend the higher grade vacuum devices since they result in the highest success and satisfaction and safety. Platelet-rich plasma, or the P-shot, can also be utilized to improve the health of the penis. In this technique, blood is drawn from a peripheral vein and spun in a centrifuge. The red cells and plasma are removed, leaving a platelet-rich middle layer. The platelets are then activated with calcium and they release growth factors. PRP has been shown to be effective in hair growth and orthopedics, but the data on PRP use in the penis is sparse. It has not been shown to be harmful, and theoretically it should stimulate growth, just like in orthopedics and hair growth. The image on the left demonstrates that when platelets change from the resting state to activated, they release alpha granules, which contain growth factors like vascular endothelial growth factor and platelet-derived growth factor, which stimulate cellular growth, proliferation, healing, and differentiation. Keeping properly hydrated is also important for penile health. Proper hydration results in more efficient blood flow through your arteries and veins, which keeps the penile tissue well oxygenated and well fed with nutrients. Physical exercise is also critical in improving blood flow to the penis. This study concludes that 40 minutes of aerobic exercise of moderate intensity 4 times a week over a period of 6 months decreases erectile problems in men. A heart-healthy diet is also essential for strong blood flow to the penis. A diet more specific for erectile function would include nitrates in leafy greens and beets, flavonoids in dark chocolate, L-arginine in pistachios, zinc in oysters and other shellfish, L-citrulline and antioxidants in watermelon, and lycopenes in tomato and pink grapefruit. Weight loss and cholesterol also impact erectile function. In one randomized controlled trial, lifestyle changes were associated with improvement in sexual function in about 1/3 of obese men. In another study on the effect of cholesterol-lowering drugs on erectile dysfunction, there were benefits of lipid-lowering drugs on erectile function. Now, in the same way that we keep in good physical shape to protect our heart, there are things that you can do to help keep your penis in shape. A nitric oxide booster like AFFIRM is essential for blood vessel health, and a PDE5 inhibitor also improves nitric oxide levels. GAINSWave therapy activates stem cells and grows new blood vessels in the penis. A vacuum erection device will increase oxygen levels in the penis and stretch tissues, preventing scar tissue and stenosis. Platelet-rich plasma is a promising development packed with growth factors, and it's also important to remember to exercise, lose weight, eat a heart-healthy diet with low cholesterol and adequate hydration. By following this advice, you'll be looking up for years to come. I am Dr. Judson Brandeis, board-certified urologist and chief medical officer for AFFIRM Science and director of clinical excellence for GAINSWave. I thank you for your attention. This webinar was sponsored by AFFIRM Science, developers of AFFIRM Nitric Oxide Booster, the official nitric oxide boosting supplement of GAINSWave. AFFIRM Science donates a portion of the profits to research on erectile dysfunction. If you are over 45 and like this webinar, please consider purchasing AFFIRM at affirmscience.com to support additional webinars. AFFIRM has been shown to increase the effectiveness of GAINSWave therapy with no side effects.